subconjunctival intraoperative injection Mitomycin-C 0.2 or 0.4 mg per ml instead of sponge-assisted trabeculectomy or combined triple surgery, a Boon. Trabeculectomy remains gold standard surgical procedure for medically uncontrolled glaucoma, but fibrosis of subconjunctival tissue leads to bleb failure, decreasing the long-term success. Adjunctive antiproliferative agents like Mitomycin-C is given to salvage the bleb. Mitomycin is an anti-tumor antibiotic from soil fungus Streptomyces asbestosus. It inhibits DNA synthesis, halting the cell replication and produces cell death. Intraoperative Mitomycin-C application was first used by Chen in 1980. Since the late 1981, its use has increased exponentially worldwide because of its effect and ease of application. However, these agents potentially have sight-threatening side effects due to cytotoxicity. Mitomycin-C is commercially available as 2 mg, 10 mg or 40 mg powder. 2 mg is widely used for ophthalmic purposes. Preparation of Mitomycin-C injection. 2 mg in 5 ml sterile water gives 40 microgram or 0.4 mg per ml or 0.04%. 2 mg in 10 ml sterile water gives 20 microgram or 0.2 mg per ml or 0.02%. To get the adequate concentration, mix 5 ml of sterile water to 2 mg powder. Withdraw 2.5 ml of the solution and transfer it to another sterile container. Again take 5 ml of sterile water and inject 2.5 ml in both the bottles to have a final concentration of 20 microgram or 0.2 mg per ml. Mitomycin-C is water soluble and appears as blue-violet crystals. It should be protected from light and preferably stored at 15 to 30 degrees Celsius. Temperature more than 40 degrees Celsius should be avoided. Dosage of Mitomycin-C is 0.2 to 0.4 mg per ml and application time is 2 to 4 minutes, depending on their potential for filtration surgery failure. But when injecting, a lower concentration of 0.05 or 0.1 mg per ml can be used. Our preparation of Mitomycin-C includes mixing the drug with sterile water diluent to achieve a starting concentration of 0.2 mg per ml. This is then diluted with 2% injectable lignocaine. Solution is prepared. It is drawn up into the 1 cc syringe with 30 gauge needle. Injection Mitomycin-C is given after corneal traction 12 mm posterior to the limbus subconjunctivally. The bolus site can gently be spread across by spatula or muscle hook over the indented scleral flap area for 2 minutes. Then the steps of trab is carried out routinely. If sponges are used, it is utilized after peritomy, taking care not to touch the cut edges. Then conjunctiva is retracted over the sponge. After 2 to 4 minutes of designated time, all the sponges are carefully removed and the area is washed thoroughly with 15 to 20 ml of balanced solution. Then the routine step of trab is carried out. Longer duration of mitomycin is preferred for refractory glaucoma, young patients, neovascular glaucoma, uveitic glaucoma, traumatic glaucoma, and poor ocular surface cases. However, adjunctive use of Mitomycin-C usage have increased the incidence of bleb-related complications like avascular bleb, hypotony, bleb leaks, blebitis, and endophthalmitis. Use of intraoperative subconjunctival injection Mitomycin-C offers better results than sponges. The advantages are ideal blood formation with less surgical time and relative less risk of above-mentioned complications. Disposal of harmful Mitomycin-C sponges is not required. Risk of aerosol liberation during the wash, unlike sponges, is not present. They are proved to be cytotoxic on prolonged exposure. Inadvertent endothelial toxicity and hence the permanent corneal damage is absent. Risk of loss of Mitomycin-C sponges is not there in injection form. And predictable dose delivery, definitely a boon. A small variation in technique may have profound effect on clinical results and complications. Injection mode of Mitomycin-C offer better results than sponges. It gives us safe, prolonged, long-term lowering of intraocular pressure and hence minimal or no glaucoma progression, although a prospective randomized study is warranted. Mitomycin-C is one of the 10 most carcinogenic substances known to human, categorized under Group B2 by US Environmental Protection Agency. It comes under medium hazard drug. Thus, Occupational Safety and Health Administration work practice guidelines for personnel who handle cytotoxic drugs must be followed strictly. Thank you.